Good afternoon, everybody. My name is Carolyn Wilson, and I am with Ledgelight Health District. I'm also the coordinator for the Groton Alliance for Substance Abuse Prevention. I'm very happy today to be co-hosting this excellent event about e-cigarettes and community health. First, I want to talk to you really briefly about what we're doing in prevention right now. As you can imagine, when it comes to prevention, there's no shortage of things that we are addressing. It's very common for us to jump from substance to substance depending on which fires we have to put out, so to speak. However, one area of interest that it's somewhat emerging if you look at history, but is certainly not new, is vaping and the use of electronic nicotine delivery devices. We, in the world of prevention, care a lot about this. We know that in terms of emerging issues, where the numbers are not getting better per se, it's with vaping. We see some of the alcohol numbers going down, and we see marijuana numbers going down in some places. Certainly tobacco in general numbers going down, especially with youth. But this is one area we need to continually speak about. And we know that depending on people's exposure and knowledge base, people have different working knowledge about the subject. So we're very excited to be doing this presentation today. Quickly about GASP, we are a community-based organization. We've been functioning now for over 20 years. I'm happy to say that I've been involved for about 10 of those years. And one of the things that we do every 2 years is we collect data from the community. We collect it from adults and parents, and we also collect it from youth. And right now, we just finished up collecting our youth data. So we will be seeing exactly how much vaping is being reported by youth. Over the summer, we're able to survey parents and adults to get their views on vaping and on tobacco. And so that data is really important to the work that we do. If we don't have that data, we don't know if we're making progress or where we need to shift gears if we do. So it's all very important. One of the ways that we talk about vaping and really any substance we're interested in when it comes to prevention is something that I literally came up with this morning called triple P, policy, peers, and parents. So those are three of the big things that we think about when it comes to prevention. Obviously, getting the message out to parents so they can have good conversations with their kids. Policy, making sure our policies are where they need to be. Policy is one of the best environmental strategies we have in prevention. And of course, peers. We want to know what peers are doing, kids and their friends, of course. So that's something that we're certainly concerned with. I'd like to thank our speaker today, Ruth Canovi. She's the Director of Advocacy for the Lung Association here in Connecticut. I've had the pleasure of working with her on a couple of things in the past, and just had the pleasure of going to one of her match coalition meetings this morning. So looking to continue my work and involvement with state advocacy efforts for tobacco and of course vaping. So thank you so much for being here today. I want to remind any of our participants today that if you have a question or something you'd like to say, you can throw it in the chat, and we will make sure that we address it by the end of the presentation. Please follow us on social media. You know how to do that, at Groton_prevents. We'd love your support there. And of course, if you need to get a hold of me, you know how to do that through C. Wilson Wellness at cwilson@llhd.org. So without further ado, let's see here.
We're good.
We are good, and I'm gonna turn things over to Ruth to get things going. I will be controlling today's presentation, so I'll try and be on my best behavior to do that as well as I can. Ruth, thank you.
Awesome. Thank you so much for having me. Thank you to those of you who are on the call today and for participating. As Carolyn said, my name is Ruth Canovi. I am the Director of Advocacy for the American Lung Association in Connecticut. And I really am excited to talk with you today about tobacco products and how they're really impacting the community and public health in Connecticut in 2020 in this strange time. If you could scroll to the next slide. I do want to give a special thanks to Ledge-Lite Health District and GASP, as well as SERAC for hosting me and making this happen. Again, it's been great working with Carolyn, and it's important to partner on these really important issues. And I know these are tough times, so I appreciate people taking the time out to address this issue that really impacts lung health. For those of you who aren't familiar with the Lung Association, we're a voluntary health organization. We've been working for more than a century now towards our mission, which is to save lives by improving lung health and preventing lung disease. And we try to do that through kind of 3 branches of work, through research, education, and advocacy. Our big vision is a world free of lung disease. And we have a number of kind of strategic imperatives and ways that we want to approach that. The one that I include up here is we're working to create a tobacco-free future, but a number of other areas that we work in, including lung cancer, trying to defeat lung cancer, championing clean and healthy air for all, improving the quality of life for those with lung disease and their families. And most recently, we've added one just around defeating COVID-19 and other future respiratory pandemics. And that kind of brings us to the next slide. And I feel like as an employee of the Lung Association, I kind of always have to talk quickly about this, in that just kind of in recognition of where we are in time and in the world right now. I want to make sure that people know of the Lung Association as a resource in this really strange time. Public and decision makers can come to our website. We're trying to do a lot around funding research and getting good information to the public about how coronavirus or COVID-19 is impacting so many of us. And just a quick PSA, a reminder to be safe and stay at home if you can, or social distance, wear a mask, and get your flu shot as well. So I wouldn't be doing my job if I didn't cover that quickly. But then I can go to the next slide and just talk quickly about today's agenda, what I'm hoping to do today. I want to talk about today's tobacco products, who's using them and why we care, and then what we can do. I really liked what Carolyn just had to say about those 3 Ps of prevention. And I'm kind of similar approach to that. And I was going to talk about what we can do as individuals, kind of as peers or community members, and then as advocates or leaders in the community, how we can impact policy as well. So we can kind of go to the next session is today's tobacco products, but we can go to that next slide. And so, this is a lot of text here, but just kind of underscoring, when I say tobacco products, it's all encompassing. So I'm talking about e-cigarettes mostly today, but tobacco product was defined by the FDA in this very long paragraph, which I won't read to you all, but it's pretty extensive and looks at this. And when we look at some of this, it's, it calls out cigarette, cigar, pipe tobacco, chewing tobacco, snuff or snus, but that's, it's not limited to just those things. And if we go to the next slide, I'm going to talk about kind of e-cigarettes really are a tobacco product. There's a number of there's pictures on here of all the different types that they can look like. And people on this call, I may be preaching to the choir a bit, but the tobacco products of today are not what they were 20 to 50 years ago. And it really is a rapidly changing landscape. We can go to that next slide and just kind of the quick basics of what are we talking about. Right, there's all those different terms: vapes, hookah pens, even Juuls, which is the brand name, but it was so significant part of the market that it became its kind of own verb and synonymous with those e-cigarettes, even if it wasn't that particular brand. But they're battery-powered devices that heat an e-liquid, sometimes called e-juice, that contain nicotine. They're inhaled. I often, you know, people will talk about vaping. I tend to really try to use e-cigarettes, especially in this format. I think when we're talking to young people who are using the products, we want to use the terminology that they're using. But I'm really concerned about when we talk about like vaping or water vapor or vape, it implies that they're harmless. I think for a long time I was hearing, oh, it's just water vapor in them. And so just kind of an acknowledgement that I'm thoughtful that I really try to use the term e-cigarette when I'm talking about kind of the broad look at these products. And then this next slide, and I wanted to call out some of these things and just say that, you know, we've known this for a while, but the tobacco industry really has established themselves as a savvy group. Even just in the past year, the current federal administration prohibited the flavoring of certain types of e-cigarette products. And the industry responded, and now there's all of these other disposable e-cigarettes that are still allowed to have flavors in them. So I did yesterday, I was kind of preparing and I did a quick kind of Google image search. And this is what came up when out looking at one of the newer products that I've been hearing a lot about called Puff Plus. People were calling Puff Bars and it's this, but I was just really surprised by the color. It was kind of astounding to me, and all of those colors really represent a different flavor. And many of them are fruit and candy flavors that are available in these products still. And then pictured on the right of this slide, sorry if you could go back just for a second. I just wanted to point out one other thing that we're keeping a close eye on, and it was just introduced to the market. It's Philip Morris's IQOS product. And frustratingly, in July of 2020, the US Food and Drug Administration authorized the marketing of this heated cigarette as a modified risk tobacco product. And it really was despite the FDA's acknowledgement that Philip Morris failed to show that this product presents a reduced risk of tobacco-related disease. And they didn't require Philip Morris to provide evidence based on US data that the product's marketing won't appeal to kids. So again, just a demonstration of how savvy the industry is, and new products are coming onto the landscape all of the time. On a meeting I was on this morning, I was kind of shocked at just other people's mentioning of other newer products coming out. So it's tough to keep up. And so we're trying to be really thoughtful about what we see. And our hope is that and we're pushing on the federal level for much more regulation of these products because it's really concerning. And so now up here, you've had a minute to look at this new this slide of can you spot the vape? Because again, like I said, these can come in all shapes and sizes. And so you've taken a look. So we can go to the next slide if you don't mind. And they've all been disassembled. And all of these products, 1 through 6 rather, not the 7th one, actually are a vaping device. And so, I mean, you saw the lipstick, the pens, the thing that looks like a medication inhaler, the watch always gets me. The final thing, the key actually is it still is a USB device, but still it's not used for vaping. And so again, these are just the things that it's hard to keep up with. And I think parents and people who care about their loved ones who are young should know about. And I think also it's just something that's surprising, you know, just kind of the demonstration of the sneakiness of this all raises a lot of flags for me. So if we go to the next slide, again, just kind of looking at these products, but with that, what else comes with them and the marketing and looking at them. There's Bluetooth e-cigarettes that can actually receive a phone call or allow people to listen to music. There's cloud contests. Again, that's often, I've seen those around for a bit. I'm hoping that that's not allowed during these strange times with COVID especially, but just kind of an acknowledgement that these are really presented as fun, interesting, often youthful products. And lastly, this goes outside of the actual, on the next slide, it shows some examples of kind of supplemental accessories for vaping that really help design and conceal these products. I mean, and one, like the hoodie actually has like some of the mouthpieces and devices that you can use to vape right in there. And again, we like people to know about these things, to keep an eye, to be able to recognize these things and spread the word so that we can be helpful to young people who are really targeted with all of this, right? I mean, I know that I'm certainly not the target audience for any of these products. And despite the fact that the age, which was a big win, has been increased to 21, there's still a lot that needs to be done in working on this. And lastly, kind of in just this part, I do want to say, you know, we've done a lot of work and we talk a lot about e-cigarettes right now, but I do want to kind of just acknowledge that the industry itself has a long history of preying on specific target populations like the LGBTQ communities and like Black and brown communities, low income communities. And so even when we're looking at e-cigarettes and these new sleek products, I don't want to lose sight of the fact that there's still too many people who are addicted to more of the traditional products as well. So even when we look at the graphs, which I'll show you soon, of who's using these products, when we look at certain subsets of the population, we just need to really pay attention to kind of who's using these products and how we can help protect everyone's public health as well. Great. So then we'll go to kind of, you know, we see what they are. So who's using them? So I think I've been in this role at the Lung Association for about 7 years. And I remember I would be talking even just 2 or 3 years ago to, you know, peers about what I do, or even key decision makers about kind of the need pushing for strong tobacco control policy. And I'd get the reaction from people like, really? Is that a thing still? You know, there's no smoking in restaurants and bars. It's really expensive now. We kind of took care of that. And this is the chart that people were referencing, right? Like we've done a great job at reducing cigarette smoking in the country, especially among youth. But even now in Connecticut, I think that the adult cigarette smoking rate is about 12%. Which is significantly lower than it was 2 decades ago, right? So I think we've done a great job at making progress towards protecting public health. But we also have really been, again, we need to look at those subpopulations, but also that e-cigarette market. And the next slide will kind of show this other story, right? And so, in 2018, the U.S. Surgeon General Jerome Adams issued an advisory declaring e-cigarette use among youth an epidemic in the United States. And again, people on this call, I don't think will be surprised by that, but I think this is always that jump in the e-cigarette use is significant, just it's concerning because that's youth use. Youth vaping has skyrocketed over the past 3 years. 1 in 5 or 3.6 million kids in our nation are currently using e-cigarettes. And in 2019, 8,000 kids a day tried e-cigarettes. So I really am very interested to hear, Carolyn, when you get that data and kind of are processing that, what story, because this is national data. I'm going to go to Connecticut data in a minute, but I think it's really important to see the trends. I also think it will be very interesting to see what happens kind of in looking at this time, because we have some 2020 data, but it was before the pandemic. So I know just anecdotally talking to people, seeing, you know, I was going to quit, but I didn't, or I quit and I picked it back up. But for young people, has some of their social access been cut off? So I think will be interesting to kind of see how this has impacted young people's use. If we could go to the next slide. So this isn't trend data, which the last chart had, but just kind of looking at high school students' tobacco use. So that's all tobacco products in 2019, because that's the newest data that we have for Connecticut. And that number is 28.7% of high school students throughout the state. Again, if you look at that, it progresses from 9th to 12th grade, which we would expect, looking at different populations based on race or ethnicity. We can see that in the yellow chart over there too. You know, I just like to point this out because I think it's important to kind of pay attention. And again, it's the smoking rate for the state is about 3.7% for young people. So that's a lot. And actually, I believe if we go to the next slide, this is who uses e-cigarette products. And so that total is 27%. So what I take away from that is there's a lot of dual use going on as well, which is another piece we're concerned. We're talking about e-cigarette use, which often is kind of the initiator, but then what else can people get their hands on? And so they're not just using e-cigarettes, but that makes up a high percentage also of what people are using. Thank you. So again, this is kind of one of those, we're just pointing out that we really are paying attention to all the different types of tobacco use. So pulled out a great slide from Connecticut DPH on just, you know, who's using hookah. And again, I was really surprised by that, like 9th grade number being, you know, higher than some of the other numbers there. But I think, again, 2019, just having a justice lens as well at looking at, you know, there's a much higher percentage of Hispanic students who are using these products. And so just in trying to determine policy and program implementation, being aware and looking at who's using what products so we know that it's appropriate and addressing however people are using these products. We can go to the next one. I think, again, that's cigars as well. So I just like to show a variety of those things and keeping it in perspective that when we're talking about tobacco product use in the general population in Connecticut for young people, it really is electronic cigarettes. But there are certain groups and products that are kind of, we're paying attention to at least in looking at this too. So I wanted to talk a minute about adult tobacco use. I think this one is really important. This is national data, but close to 1 in 4 adults in our country are using tobacco products, including e-cigarettes. But when we look at actual adult e-cigarette use, it's really been essentially flat since its widespread use and the huge increases that we saw with young people. Prevalence was around, you know, has been around 3% among adults in 2018. And we haven't seen any strange spikes with that. And I like to say it because I think in lots of the work that I do, I sometimes get pushback of, you know, my friend's cousin learned to, you know, quit using these products. And so one, I think we need to prioritize youth health in this means, especially because there are many FDA approved cessation treatment methods and electronic cigarettes are not an approved cessation device. And I just like to underline that because I think it's really important because we always, I know I in my work hear a ton of anecdotal advice, and one, it's not an approved cessation device and there's nothing that proves that it is in the US. But when we look at who's actually using these products, it's minimal in comparison to young people. And if we go to the next slide, I did want to touch briefly when we're talking about these products, just about flavors. And so one trend that we did see with the newer data from the National Youth Tobacco Survey is that 2020 did show a decrease in youth use of electronic cigarettes. So going in the right direction. But when we looked at the types of products that were used, flavors were a big player. So over 80% of youth who use e-cigarettes use flavors, but also in what products were used because of that shift in policy where flavored products like even the Juul cartridges, they're not allowed to sell them unless it's the menthol. The menthol or mint was kept into place, but all of those other flavors were prohibited. So one, we saw an increase in the menthol use of Juul, But then we also saw, I believe it was 1,000% increase in the use of the disposable flavored e-cigarettes. So it's really showing that young people are following the flavors. So in the policy that was passed, we were really kind of picking winners and losers of tobacco products and like how the kids should, the types of products using. Like it was really surprising, even though the Tobacco 21 law was in place. We know, I mean, even with lots of your work with alcohol, I'm sure you see, it was a very important first step in passing the law. But there's other work that can be done. And I think flavors, and I'll get into that a little bit more, but just kind of at looking at the data and what people use, we're seeing this loud and clear that young people really do follow the flavors. So wanted to point that out. So, you know, why do we care? That sounds a little harsh, but just kind of wanting to remind people these are tobacco products. And so when we look at the numbers, first of all, still today, these are current numbers. We're still seeing lots of the impacts of cigarette smoking now, even though lots of people have quit. Not to say it's always a good time to quit, but just want to kind of point out that in Connecticut, every year, 4,900 people die from smoking. And if we kind of continue to go on as we have seen, we can expect 56,000 kids who are alive now to die prematurely because of smoking. It's a lot. And then even if we kind of put that aside, which I never do, it's really important when we're talking about, you know, number of years lived in quality of life, we can also look at the economic cost to the state, and it's significant. Annual healthcare costs in Connecticut directly caused by smoking, 2.3 billion, to Medicaid, 520 million. Even if you're looking at like just productivity losses in the state of kind of how that impacts it, it's another $1.25 billion to that. And so we're still paying the price. It's significant. And so we care. If we look at the next slide, I wanted to talk a little bit about kind of the e-cigarettes, right? And so what's in them? For the longest time, I think I said I was hearing a lot about, oh, it's just water vapor or whatever. Even if you ask kids now, lots of them don't know that there's necessarily nicotine in these products. And so just a reminder, it's not water vapor. There's nicotine, there's volatile organic compounds, ultrafine particles that can get lodged into our lungs, heavy metals, cancer-causing chemicals, and flavoring as well, which again can be in some of the things that we eat, but in looking at how it impacts our lung tissue is concerning. And so I often say, you know, or people will ask, like, how do we know? And I've got a lot of concerns here. If we can go to the next slide, I just want to say, like, one is electronic cigarettes have been on the market for, I mean, generously, I think it's about 2006 is when we saw some of the first things on the market. Comparison-wise, the first Surgeon General's report on smoking cigarettes came out in 1964. And we're still discovering ways that smoking impacts our health. We have, I mean, the information that we have and the way that our bodies are like processing what we're doing with these e-cigarettes is, I mean, we don't know essentially still what the long-term impacts of them are. And I don't want us to be finding this out too late. We do know that inhaling anything into our lungs outside of healthy, clean air and like health provider prescribed medications isn't good for us. Even when we talk about, you know, like having a fire outside, that smoke isn't good for us. There's a wide variety of ways that, you know, our lungs can be impacted. And so I just want to flag that. So even when we're talking about this, and it's a slide that talks about tobacco and e-cigarette use, there are short-term effects that I think sometimes young people can, that stuff can sometimes matter a little more than the long-term effects when kind of making those quick decisions. But I just wanted to kind of flag that this is all still really developing science. And when I'm considering the source and where these products are coming from, because most of them are owned by traditionally like big tobacco, which does not have a great reputation for keeping public health in mind. I get really concerned, and I think it's safe and reasonable to err on the side of caution. And what we're seeing now is kind of everything with the short science that we're seeing, short-term science, is that these aren't good for us. And so just wanted to kind of to point that out, that there's a lot that's up in the air, but there are short-term effects. When we're looking at tobacco, I mean, we know all of the cancers, the heart disease, that can be impacted by us. And I'm sure everybody on this call has been impacted in some way by it. And it's disheartening to see kind of the changes in progress that we've made over the last few decades. The other thing that we talk a lot about with young people is teen brains and nicotine, right? So nicotine is incredibly addictive, and young people are especially susceptible to that. So it helps build some of those pathways and primes people up for further addiction of other products as well. And so just wanting to underscore that no tobacco product is safe for young people. Nicotine really can change a young person's brain and lead to more addiction as well. And then this other one, which again, we're still looking at, but one is we've seen a real increase in number of calls to poison control centers with all of those little, I can't even say juice because it's infuriating, but those vials of liquid, they can look fun and interesting to young people who drink them. So looking at poison control calls is really concerning. And then the other thing is just, these are battery products. And so I think it's, again, this isn't like the number one concern, but just acknowledging that we've all seen the news articles and the horrible stories of these things blowing up or causing fires or hurting people in one way or another. So that's all the like frustrating and challenging news, and it's hard. It feels bad, especially when so many like public health professionals have worked really hard and made a lot of progress. But just to kind of set the stage of what we're up against, but I think we also kind of know what works and can use tools in working to help protect the health of young people and everyone in our state and communities. And so again, like Carolyn said, I want to talk about this kind of on the individual, community-based, and policy level inside of things as well. So the first thing I want to say is quit, don't switch. So if you're an adult anyone, if you're using electronic cigarettes, we want you to quit any tobacco products. And if you're not, don't start. And just as a reminder that, the FDA has not approved any e-cigarette as a quit smoking device. They have not found them to be safe and effective. Medication plus counseling really results in highest rates of success in quitting. And there's just a listing of all of the different FDA treatments that have been approved. The other thing is that, there's a lot of other resources. 1-800-QUIT-NOW. The Lung Association has some programs, one Freedom from Smoking. And then also, even if anyone has any lung health questions at all, they can call our lung helpline, which is 1-800-LUNG-USA. So just kind of a reminder that that's always my first thing. If you are using products, quit, and there's a lot of resources available to help you, because that is also a model for the young people around you. And so that brings us to that next resource that we have in prevention or cessation, really, is talking to the people that we care about in our lives about these products. I actually was talking to my boss yesterday, who told me a story. They're not in Connecticut, but his sixth grader saw, someone else in the school vaping in the school, and kind of was balancing that. And I'm like, well, that's our mission, and living that for sure. But it's something that people at young ages are dealing with and being approached with. So it's never, start young and have those conversations. Don't be afraid to. And the Lung Association did develop this. It's called the Vape Talk. There's a couple of videos and a conversation guide. But and I think lots of us who are on the call too, just being comfortable saying, well, what do you think about that, or what are you seeing? And giving opportunities for young people to express their questions or concerns, and making sure that they know that you don't approve as well. And so the next slide just has some of the signs of use. And again, one of the things I've talked about on other calls is the challenge of, is there an addiction here, or is it sneaky, moody teenager life, which can be hard, but some of these things I think are important, like the fruity and sweet scents around the teen or in the room. And again, we kind of looked at all of those different types of products that are designed to conceal, but just kind of being on the lookout for some of those things, even like becoming thirstier than normal, seeing unexplained flash drives or those little pods that sometimes end up in, the washer machine or dryer, and those types of things are signs. And hopefully you're not at that point, but they can be good opportunities to have those conversations with the people in your lives. The next one, again, and this is, parenting stuff, but the trying to ensure that your people in your life know that it's safe and okay and acceptable not to vape. And so giving ideas like quitting tobacco yourself, but also like, hey, letting your kid, using you as an excuse is always awesome. And so just another idea as ways that we can, as parents or community members or important adults in our kids' lives, as just ways to provide kids some cover and excuses and strength to say no when those times come up, because they do. And I just wanted to also share one slide about just helping support your young people in your life who use e-cigarettes if they want to quit. So we have seen that counseling is helpful. Any of those kind of FDA approved medications can be problematic, especially, there's lots of issues for young people. And so there's the data out about how that works is up in the air. But have conversation with your healthcare providers. There's resources out there. There's some things called My Life, My Quit, teen.smokefree.gov, even like the 1-800-QUIT NOW, and the Lung Association programs are available. The Truth Initiative has an e-cigarette quit campaign that has some texting. So there's a lot out there. And so just kind of a reminder that there's a lot of resources. A lot of people are dealing with this. And so helping to support young people quit is really important as well. We can go to the next, and I wanted to get into a little bit more of some of the community work that's available and out there in some Lung Association programs that we have. One is called In Depth, and it's a free program for people to get trained in, but essentially it's an alternative to suspension program, right? I think sometimes we see, I feel like, again, these are strange times, but in talking to school administrators, just the disruption and the challenging of managing this increase of use and people using e-cigarettes in the bathrooms at the schools or in the classrooms and how to deal with it. And instead of necessarily just sending them home to maybe vape in their rooms or couches, really like having an in-school program for young people to participate in. It's not necessarily a cessation program, but really kind of an informational and educational program to let young people know what's actually going into their bodies and how they can end it. It's so it's newer to us, but I think it's important because I do think that trying to give people more tools instead of the punishment can be helpful. And then another program that we have is called Not on Tobacco. And this is more of a quit cessation program that we have available. That's, again, people can get trained to become a facilitator in the program. But it says, approximately 90% of teens who participate in the program want to cut back or quit tobacco altogether. So, again, trying to meet young people where they're at. And this one's voluntary. So you've got to come ready and in some capacity to quit, but it's a resource that's available for cessation. And then the next slide, I think, you know, people on this call are probably doing a lot of this. I know there's some great work being done in Connecticut, but I just wanted to share that there's a lot of cool teen empowerment, peer prevention and cessation work that is being done. So there's some links here, and I'm happy to share wider if anybody wants them. But I just, as an example of, right, that peer piece in prevention. So acknowledging that even when those numbers are high, we're not at 50%, like more people aren't vaping or using e-cigarettes than not. So trying to use that peer pressure not to do it, and normalizing not using these products as well. And that gets to media. There's a lot that can be done. There's some media campaigns out there right now, and these are just some samples of ones that exist. The CDC has been doing some great work, and even like the Tips from Former Smoker campaign that they do is great. The Lung Association just partnered with the Ad Council this summer to do this spot on, it's called Get Your Head Out of the Cloud, and I can send the link if anyone's interested, or you can YouTube it. But it's kind of a good look at how parents might look at some of this and think like, oh, it's not a big deal, or my kids would never do it. And just trying to raise awareness about the products and their dangers. And so I think these media campaigns are really important, because the next slide I felt like I needed to add a little piece about the reach of e-cigarette marketing, because young people are getting a ton of that. And so just the importance of pushing back against the marketing that they see and where they're getting it. And so 7 in 10 teenagers were exposed to ads, and then where. And so there's retail ads, internet, movie, which again, that's not quite as much, but even newspapers or magazines, and where those are coming from. It's important. And again, I know these are anecdotes, but I think a lot of people can identify with them. I have got a colleague who said they're like, you know, 5th grader or something was playing a video game and got an ad that was about a product. And so I think it just kind of underscores messaging is going in early. And so not being afraid to have those conversations, but also trying to ensure that some counter messaging is out there as well. And then the next one, again, we've talked about this and we've seen it a lot of the other different types of marketing strategies. And one is promotion. And so this is actually a way that I think young people can get pretty empowered and interested and engaged on some projects. I think young people often will really respond to being critical consumers. So I've seen young groups look at being critical consumers of the ads that they're seeing, or going into convenience stores and seeing where these products are placed versus where candy is placed, and the signage. So there's just a lot that can be done to help educate young people in being critical consumers of what they're engaging, and having a critical eye as to all of the things that are out there. And if anybody's interested, I think there's a group called Reality Check in New York that is doing some pretty interesting work on that as well. So those are some of the things that we've got there. And then there's policy, and there's a lot that we can do. And so here I just wanted to talk briefly kind of where we're at with Connecticut. There's kind of what the Lung Association looks at as like tried and true best practices that we've seen be effective for traditional tobacco products that we want to encourage and ensure that e-cigarettes and all tobacco products are included here. So we have our annual State of Tobacco Control report that we look at these different areas and kind of grade Connecticut. And we actually tend to not do great on this report in terms of our policies that we have. And so we know that having high tobacco taxes really impacts and helps people quit. And access to quit smoking services is really important. We need to have tobacco prevention funding in the state, which still is very frustrating to me in Connecticut, because we get a ton of money in from revenue and the master settlement agreement, which was the lawsuit with the industry over 25 25 almost years ago, or I believe it's 20 years ago, but anyway. And so we should really be spending a lot more on prevention in the state than we do. But smoke-free air laws in Connecticut, we tend to get a C. We have done a good job with restaurants and bars, but there's a number of kind of loopholes that exist in the state that need to be closed up. And then Tobacco 21, which we passed, and then actually is the law of the land throughout the country as well. A number of states, I think we were 15th or 16th in the country to pass it, but then it was a federal law that passed as well. So that was pretty exciting. And then I wanted to just take a minute to talk a little bit more about kind of some emerging state trends that we're looking at. One is flavors. And so again, the federal government has done some work on flavors, but it's not comprehensive. So it's not doing all that it should be. So Connecticut will be looking at how to prohibit flavored tobacco products. And so I think that's really important. There's, I mean, over 15,000 flavored products on the market. And I think, you know, we've talked a little bit about that, but it's concerning, and they bring young people to the table. And so we can do more to protect our young people and make that a public health policy. Another thing that's interesting is we're seeing kind of throughout the country is that with COVID-19 and mask expectations, a lot of casinos, if they've been reopening, have decided to have a smoke-free or tobacco-free policy. I know that in Connecticut, one of the 2 tribal casinos definitely had a tobacco-free policy, at least when they started to reopen. And so that's just another area. Again, it's tribal land. And so it would kind of need different ways to go. But if we're looking at protecting employees who are spending a lot of time in places, that's a trend that we're seeing kind of throughout the country that I think at least should be, you know, we can take some notice here in Connecticut. But again, one of the challenges that we'll be facing is budget, which is always hard, but these are especially hard times right now. And so looking at what is going to cost the state money short term, unfortunately, because while we know we can save the state a ton of money long term, that's not always how these decisions are made. So just a context that we're looking at. And just one little kind of area that I wanted to talk about, because we haven't talked a lot about at this point, and it's something that the Lung Association does, is research, and it's a priority. And so I just wanted to show that we're kind of really trying to put real dollars to work on this issue, because I think one thing that is evident is the need for more data about how these products are really impacting our health. While we have small indications, or no, I won't say small, but indications that they certainly aren't good for us, we want to have better and good data that we can really point to, especially long term, to know how these things impact us. So we have a lung health cohort study that's pretty exciting, that we're partnering with Northeastern University in a $25 million NIH grant to study kind of longitudinal health. And so that's going to be very exciting and just something we're going to be paying attention to. And it's a long-term thing. But we also, through awards in our grants program, are funding a number of studies that are looking at vaping and lung health and young people. So just wanted to say that, you know, we're doing policy work, but we're also trying to spend our money in ways that will help hopefully improve policy, but also just get us good information that can inform the general public about how these products are hurting our lungs and our community health. So I did want to share just some final thoughts and wrap up. Oh, you know what? I think I added this. It's okay. I added a slide after I sent this to you, but I can do this. It's not that important for you to see this, but I wanted you to have some resources. Actually, I think that's okay. There's these resources that exist. And if you go to the next slide, is there anything else? Yeah. Okay. I like when that happens. So consider the source, right? The industry owns these products. They're designed clearly for their target next set of consumers and next generation of consumers. E-cigarettes are not a proven cessation tool. They're the most used tobacco products among youth, but adults use them at a rate of just over 3%. We want to be thoughtful about how kind of all tobacco products still are impacting populations. And so when we're looking at all of this, I just want us to be thoughtful and make sure that we're approaching this kind of with a health equity lens and making sure that we don't leave anybody out of this. One thing I didn't get to was with the Family and Tobacco Health law that was passed in 2009 that kind of got e-cigarettes. There's a lot that happened there, but all cigarette flavors were prohibited except menthol cigarettes. And so that's an area that has really historically targeted, like menthol cigarettes are incredibly advertised in low-income populations and populations that have been historically populated by Black and Brown communities and the LGBTQ communities. So I just, we want to make sure that when we are looking at programs and policies, we don't leave anybody behind and want to make sure that we're addressing all products and people. Quit, don't switch. We want people to use the Lung Association as a resource and talk with people, your loved ones, about the products and why you're concerned. And then that final plug to just wear your mask and get a flu shot. Be kind to everybody and yourselves. These are really hard times. So thank you, Carolyn, for the opportunity to speak today. I hope that this is helpful. And if nothing else, I just hope that people feel comfortable reaching out to me if I can be helpful, and want to do more to protect the public health. So thank you very much.
Wow. All right. So, Ruth, I can't say enough about that presentation. I think it's amazing. And I think it's a very comprehensive look at all things tobacco and vaping and why we still need to talk about it and all the emerging trends and how this isn't going anywhere. We had a huge policy win with Tobacco 21, but I've even heard some people talking about, well, what are we going to do about the 18 to 21-year-olds who have already started, and then what are they going to do to get their things, and what if they go to illegal products and they get sick? And there's so many things to consider. And let me tell you, if you didn't know a lot about vaping coming into today, you know a whole lot more, and probably everything you really need to know. So I can't thank you enough. Now, before we go, I took a couple of notes on my fancy new tablet here.
Oh, nice.
Yeah. And, just some things that were really, I wanted to, double down on. We do a lot with prevention. And so we have to think about vaping in terms of other substances too, like marijuana or THC products.
Yes.
That's an extreme concern. And some of the numbers when we were talking about cigars, the first thing I thought about was, well, are they really smoking cigars, or are they using the cigars to smoke marijuana? So that was something that came into my mind. The 80% of youth using flavors.
Yeah.
So yeah, that's what they're doing.
Yes, they're interesting, right? Who wants to, if you've never done this, tobacco flavored stuff isn't appealing or it doesn't taste good. Like menthol specifically is designed to make it easier on your throat. So
yeah, and when I've worked in the past with adults trying to quit smoking, one of the things that we suggest them to do to make it a little less enjoyable is to switch to non-menthol. And they're like, I don't want to do that. It's like, exactly.
Right. Yes, it's important. Yeah,
exactly. I love your message about quit, don't switch. You know that I work with people when funding allows to do tobacco cessation, and that question comes up all the time.
Yes. Well, and the thing is, people will say they've quit and you're like, well, did you stop using e-cigarettes, right? Because most people don't use the patch. unendingly. You're not like, oh yeah, I quit 20 years ago, but you know, I still got the patch. There's like a method to that. So, right. It's switching. It's not
Right.
quitting. Yeah.
Yeah, so that's a very important message, and I haven't talked to a ton of people who have been successful with that. A lot of the same strategies about talking to your kids about vaping that obviously can go with any other substance, and
Yes.
how to talk, get your expectations across, having a dialogue, being clear, all of that is super important for prevention across the board.
Yes.
And I love the in-depth program. Is that live? Is that ready to go, like for schools? And
Yeah. So, I mean, it's a training that's available. So like school professionals can get trained in it, but yeah, it's available. It's a lot of it's done online and it's free. So look on our website for more information if people want to get trained in that.
Terrific. I'll be talking to our JRB about that.
Yes.
And I'll be talking to certainly the high school administrators
Yeah.
as well. And then of course, not on tobacco for any of those teens that are using, and that's just for tobacco, not vaping primarily.
Well, it's both. Yeah.
Oh,
No, it's yeah. So when we use tobacco, we're trying to incorporate everything, and it would just went through a kind of a new revamping to ensure that it includes electronic cigarettes and vaping devices.
Terrific. Now I'm going to go to the chat really quickly here.
Yeah.
And see what we have. Will we be able to share this with our community? I'm a parent. Yes, I will be putting this on our YouTube channel. I've got the blessing. This will be available. I will probably also stream it on Facebook later, do like a watch party.
Yeah.
So people can see, because we want as many people to see this as possible. Yes, are the presentation slides available? Is it public or?
I could probably PDF them and send them if people want. You can reach out to me. It's ruth.canovi@lung.org. I'm happy to kind of help. It's been so we'll see, but I'll try to get you the best I can.
All right, so that's a strong maybe, and
yes,
contact Ruth for more information.
Yeah, for sure.
Okay, and what is the website for the free training?
If you go to lung.org, you should be able to easily find it's in depth is the program. So I'm going to do it right now and see if my search function is working. If not, I can follow up real quickly with the exact link to make that happen. Because of course, sometimes these search functions don't work right away, but I can follow up and see if we can get that.
Sure.
Or people can reach out to me. But if you go to lung.org, it shouldn't be too hard to work. And look at you. Thank you very much for sending that. Quit smoking, helping teens quit in depth. So that's in the chat. I appreciate you sending that to me.
Awesome. All right. So once again, Ruth, thank you for your time. This was an excellent event.
Thanks for including us to be part of this. It's great working with you.
You go to the experts, you go to the best, and I can't say enough about the Lung Association of Connecticut. So thank you everybody who came and attended, and I will stop the recording here and say thank you all, and I appreciate it, and make sure to have those conversations and get in touch with Ruth or get in touch
please,
with me.
If we didn't answer any questions or you have questions afterwards, don't hesitate to reach out. Thank you very much.